myFoot for diabetic wound management. Diabetes is arguably the nation's greatest public health challenge, affecting over 1 million Australians. Australia ranks poorly by international standards. While there are 9 diabetes amputations per 100,000 people in the UK, an average of 12 in the advanced economies, ours is second worst in the advanced economies with 18 amputations per 100,000 people. Foot wounds are a major cause of hospitalisation of diabetic patients. Most diabetic patients develop foot problems after age 40, and these problems increase with age. Regarding amputations, 24% are toes, 6% midfoot, 38% below the knee, 21% above the knee. The remaining 10% include hip, pelvis, and other sites. Multidisciplinary foot care teams and better use of podiatrists have been consistently shown to prevent and heal many more foot ulcers than professionals working on these problems alone. Amputation comes due to diabetic foot ulcers originating from peripheral neuropathy, peripheral arterial disease, and infection. Management of diabetic wound includes aggressive debridement down to healthy bleeding tissue to establish a degree of penetration and to remove necrotic tissue. What happens next will determine whether the patient will keep or lose some part of their toes, foot, or leg. Once the wound has been cleaned, antibiotics are started, and with some instructions, the patient is sent home. Empowered with myFoot, the patient can now communicate with their nurse practitioner remotely to manage the healing process and beyond. At intervals agreed between the patient and nurse, the patient will snap an image of their wound using the still or multiple still setting, depending on how accessible the wound is. As blood glucose can be challenging to control during infection, myFoot will also put the blood glucose reading for the time of the image together to give a further indication of whether an infection is present. This data will eventually write directly to the patient's EHR and will allow their multidisciplinary team to monitor the healing process and help with management. Let's not forget about patient education though. How many failed attempts have there been at informing patients of their condition and how to manage it? Thousands. myFoot delivers education in the moment with audio-video recorded content in the context of their treatment phase. Each time the app starts, instructions will automatically be given in a reassuring voice on how to take the image for today, as well as any other steps necessary to ensure there's a high-quality result to be shared with the care team. As time goes on, the education program will automatically run either before or after data capture, and the patient will not be able to bypass. The content will be very brief, upbeat, and provide regular encouragement through a gamified reward system. Additionally, the care team will have the ability to remotely queue educational content for individual patients based on progress through sending audio, video, and text message, and use the inherent video conferencing features in the mobile device to communicate face-to-face. This is a teams and tools strategy.
And finally, here are some mock-ups of the user interface. Simple, elegant, and high contrast design built with the end user in mind. Thank you for considering myFoot for the Health Apps Challenge 2013.